now for something completely different. On to the Health Watch, where we talk about all things trending in the medical world. And as always, happy to be joined by Dr. Syed Hussain from Trinity Health of New England. Good to see you again, sir.
Likewise, thank you.
Glad to have you here. Okay, first thing, want to start off by noting that this week is National Sleep Awareness Week. Very timely, considering all of us are still trying to adjust to the changes of daylight saving time. But there was a new study out there that found that sleeping fewer than 6 hours a night before you get a COVID shot might limit your body's response to the vaccine. Now, again, just one study, but can you offer why that is and maybe some of the other influences that sleep has on our health?
Sure, Tim. So this is a meta-analysis that looked at a number of different sleep studies. They found a statistical significance in terms of men who sleep less than 6 hours on an average and how their body's immune system responds to influenza, hepatitis A, and hepatitis B. And that data was extrapolated to say, okay, this probably applies to most vaccines, including COVID-19. Okay. We know that adequate sleep, which is 7 to 8 hours, is necessary for the body's immune system, and also a lot of different host of functions that the body performs to ensure that everything is optimal.
Does it help that this was a meta-analysis looking at a lot of other analyses? Is that stronger evidence than if it was just one study?
Yeah, that's a good question. It is, because it removes they removed some of the subjective analysis or studies that have been done. So they looked at objective metrics such as those that are used in sleep labs, for instance. Okay. And that's how the data was collected.
All right. This is one that I know some people, especially here in the newsroom, want to know more about. The FDA has approved Pfizer's new nasal spray, and I don't know if I'm saying it right, Zavespret. I'm just going to say it, 2 Z's in there. It's weird. Now, this is for the treatment of acute migraine. The drug is expected to become available in July. Why aren't there a lot of drugs like this out on the market?
So there are a few that are similar, Tim, but the really good thing about this medication is that folks that have underlying medical problems, including heart problems, can safely take this nasal spray. And the effects of the medication should kick in within 30 minutes to 2 hours, as per the study that was conducted by Pfizer. So again, very promising. This is a common condition that folks experience. So looking forward to this medication.
And my understanding is you don't run the risk of getting overuse headaches like you do with other medicines. That would be wonderful. All right, on to colon cancer diagnosis. Those diagnoses have nearly doubled in people younger than 55, according to the American Cancer Society. That makes early screening very important. And I think even in a lot of younger people where it's caught, it tends to be at sometimes an advanced stage too, not just at an early stage.
Yeah, this is a warning sign for us. There needs to be more emphasis that we need to put as providers and healthcare leaders on the importance of colorectal cancer screening. If colon cancer is detected early, there's a 91% survival rate, 5-year survival rate, which means it's excellent. But it goes on to underline how important it is, Tim, to get that annual screening done once you're above the age of 45, if you have no risk factors. Now, if you do have risk factors such as a family history or radiation therapy to the abdomen for other type of malignancies, then it's less than age 45 that you need to get the cancer screening done. Or if you have a rare hereditary syndrome called Lynch syndrome. But bottom line here is, if you're 45 and above, you have no risk factors, it's important you get that cancer screening done, unless obviously if you have any symptoms and any change in bowel habits. If you notice any blood, rectal bleeding while you pass stool, then those are red flags that you should definitely see a provider very soon.
Yes, and colonoscopy, of course, is still the gold standard. Not always a pleasant experience for people, even just looking at the amount of time you have to take, maybe a day off of work. Want to talk more about that process maybe next week.
Sure.
I'm talking about myself. I'm 46. I should have had a colonoscopy by now. I haven't.
We can schedule one for you.
Maybe we should do that there. I also want to talk about other alternatives if you don't want to take a day off of work. But those are the things we can talk about next time. Doctor, thank you so much.
Thank you.
Dr. Syed Hussain from Trinity Health of New England. Good to get a good doctor's opinion right here every Wednesday around this time.